Let's now go to what is being described as the big winner in the coalition government's first budget. Overall spending in health has been bumped up by $3.2 billion over 4 years. Free doctors' visits have been extended to 13-year-olds. It will be cheaper for community card holders. There's $750 million of new money to tackle building problems. That's $600 million more than National pledged last year. DHBs, district health boards, and boy, we've been talking about them a lot, and we're going to again in a sec, who are currently posting large deficits, will also have $100 million to draw down on if they need it. Health Minister David Clark joins us now from our Parliament office. Minister, thank you for joining us.
Thank you, John.
I feel like over the past year we've discussed a lot how much pressure DHBs are under. And at first we were talking about deficits, then we were talking about deferred and delayed capital expenditure. Is this anywhere near enough what you have announced today in terms of extra spending?
Oh, look, I can't hide my excitement. This is the biggest spend in health in a decade, certainly the biggest in at least a decade on capital. $750 million set aside to start fixing some of the problems that we've got in terms of rotting, moulding buildings, capacity constraints, and also outdated facilities, mental health facilities that are from another era. So we can get on with some of that on the capital side. In terms of primary care, making sure our most vulnerable get access to GP visits. We're told that over 500,000 New Zealanders in any given year can't afford to go to a GP, for goodness sake, and here we are now rolling out to a number greater than that of community services card holders, those very low cost access prices under $20 for a doctor's visit. In some cases that'll be up to a $50 saving, or at least 20 to 30 for most people, and that will make that care more affordable, and it keeps costs out of the system for everybody else as well, because they get seen when they need to be seen rather than when they've got really sick and end up in an emergency department. And on top of all of that, we're getting on with getting real about an ageing and growing population and funding our DHBs better so that they can provide the care and services that New Zealanders would expect and deserve.
Having said all of that, I want to quote you to you. This is the largest DHB funding increase in the last decade, but even this will not be enough to make up for 9 years of underfunding. Rebuilding our health system will take sustained investment. So where are we still going to see the shortfalls?
Look, our workforce has been stretched for the last 9 years, and I want to thank them for continuing to deliver services, because everywhere I go people still speak about the amazing service they get when they get into a hospital or see their GP. But we've got to build the workforce, and that will take time. We've got to repair buildings, and even the workforce to repair the buildings will have to be built, because there hasn't been so much capital investment in recent years. We'll need firms to gear up to deliver the repair work, the delayed maintenance, to build new facilities. So there is more to come, but this is a really important first step.
Can we talk about DHB deficits? So 155 million, I think, when Labor last left office in 2008, combined DHB deficits. Amy Adams said before that was a higher figure than the last government left you guys. What is the overall DHB deficit now?
Well, it's around 200 million is the current anticipated deficit. It could go further than that. I'm very keen that we focus on delivering the services New Zealanders expect and deserve from a public health system, but I have clear expectations also on the DHB chairs that they will spend money wisely and prudently, and so I'll be expecting improved performance from those DHBs. They are getting a shot in the arm, but I'll also be expecting them to spend that wisely.
But by golly, I spoke to you, I spoke to DHB CEO, chair, medical officers of health who said there are no more efficiencies. We can't save any more money. The budgets just aren't realistic.
Yeah, and that's why, so the last few years have been 300 million, 400 million, 439. We've leapt it straight up to 549 for the DHBs. That's a significant shot in the arm, because we recognise that things have been stretched so far. You can only stretch a rubber band so far before it breaks, and we believe that we need to invest more in the DHBs so that New Zealanders get the services they'd expect and deserve.
In material terms and meaningful terms, in terms of the services that people will notice differences to, whether it's capital expenditure buildings or whether it's shorter waiting lists or more operations, what is going to be the most obvious benefits of this increased expenditure?
Well, I think, part of what you're seeing there, we're going to increase the number of elective surgeries and planned procedures, and I've got a project underway to make sure that we're not having the perverse outcomes that we had with the way the system was operating previously, where some work was being done in hospitals just to pump the numbers up that could have been done in primary care. So we'll see more elective surgery procedures. We'll see more money going into the mental health ring fence. I'm expecting that to be north of 50 million across the country. It's delivering those basic services, John. We won't fix everything overnight. No one's pretending that, but we're investing real money in those services we'd expect. And the big injection into primary care, which is more money than's gone into primary care for a decade, that will mean people get the services earlier. So hopefully that will take the pressure over time off our hospitals, because people won't be getting sick when they shouldn't be. They'll be getting that growing illness will be prevented because they'll go and see their GP, get the care they need, and be well in community. And that's the first thing. And the pressure off the system is an added bonus, because we all pay for that currently.
A pressure that has been described in so many facets of the system. Mental health is another example. What difference will this budget increase make there?
Well, again, in primary care, making sure that people can get to the system early, because GPs refer to specialist services. If you can't get into a GP, so many people are missing out on the mental health support they need because they just can't afford to get to their GP. On top of that, the Nurses in Schools program is getting rolled out to Decile 4 schools. That's another 24,000 secondary students that will have access to Nurses in Schools with the mental health support that goes with that program, which is proven to work through research, evidence-based. And we're also rolling out a pilot, we haven't said so much about this yet, but 18 to 25-year-olds in one location, we're going to roll out a pilot for talking therapies, integrated therapies, based on an English model to see how that works here. So we've got some steps forward. Obviously, we've got the review of mental health and addictions underway, which reports back at the end of October, and that will present an opportunity, I expect, to rearrange how we deal with mental health, and no doubt some new initiatives then too.
Minister, we're delighted to have you. Well, just before you go, one question I want to ask you, and this is work that we were looking at, particularly in terms of the relationship between the Ministry of Health, who seem to be putting words in the mouth or on the page of the former chairman of the Canterbury DHB. How do you improve the relationship between the Ministry and some DHBs? How do you have an ability where the DHBs are able to speak truth to power without fear?
Well, I think, John, and I hope that relationship has warmed. I've certainly received a lot of positive feedback from DHB chairs, not elicited, not forced, not written for them, saying that they are glad that the relationship is warm, and they feel like they can get in touch, and they feel like I'll get back to them, and they feel like they're heard. I think those are basic human courtesies, and in our health system, we've got a whole bunch of people who do it because they care about people. That's why they become health professionals. That includes the management in those health systems. They're often beaten up, but they're actually doing it because they want to see New Zealanders get better healthcare. And if we're going to improve the health system, we need to harness all of their efforts. And I'm grateful because they have been forthcoming with advice, and I think that's making a better healthcare system for everybody. The relationship is warming and is improving all the time.
One final question. We're delighted to have you. Where does the Dunedin Hospital rebuild fit into this expenditure?
Yes, there's money set aside in contingency for the next stages of that, the planning stages. Obviously, we don't want to publish the number because there's negotiations to happen with architects and others. It's a commercial negotiation. There are a number of items that are set aside in a contingency that aren't even included in the 3.2 billion figure we're quoting to deal with other cost pressures we expect in healthcare, and so that we can get on with that Dunedin Hospital
So the
rebuild.
Dunedin Hospital is over and above, or separate to?
It is separate to the 750 million capital set aside for capital works. The next stages of that project, in terms of the planning, there's additional money set aside for that.
Health Minister David Clark, thank you very much indeed for joining us this evening. Health Minister David Clark, who, well, setting aside the families package, which was announced in the mini-budget some months ago, was the biggest beneficiary of the budget today in terms of ministers.